What does dry powder movement in my inhaler mean? Imagine taking a deep breath and feeling the medication travel smoothly into your lungs. That's what the movement of dry powder inside your inhaler is all about. When you use a dry powder inhaler, the powder needs to move properly to deliver the medicine effectively. If it doesn't, your treatment might not work as well as it should. So, understanding what this movement means can help you get the most out of your inhaler. Dry powder inhalers are devices that deliver medication in a fine powder from directly to your lungs. Inside the inhaler, the medication is mixed with carrier particles, often lactose, which help keep the powder flowing smoothly. When you prepare to use the inhaler, you open the device and prepare it for inhalation. When you take a quick, forceful breath through the mouthpiece, the airflow creates forces that break apart the compacted powder. This process is called de-agglomeration. Once the powder is broken apart, the small drug particles separate from the larger carrier particles. The tiny drug particles are what travel deep into your lungs, where they can work to open airways or reduce inflammation. The larger carrier particles are usually too big to reach your lungs and are either swallowed or cleared from your mouth and throat. In asthma management, dry powder inhalers are used to deliver to main types of medication: bronchodilators, which relax your airway muscles to make breathing easier, and corticosteroids, which reduce swelling and mucus in your airways. Because dry powder inhalers are breath-actuated, they don't requiring you to coordinate pressing a button and inhaling at the same time, making them easier for many people to use correctly. If the dry powder inside your inhaler isn't moving properly, you might notice that your medication isn't coming out as expected. This could happen if the powder is clumped or if the inhaler isn't prepared correctly. To avoid this, always check that your inhaler is loaded properly and follow the instructions for opening and inhaling. Make sure you take a quick, forceful breath to ensure the powder is dispersed into your lungs. Proper technique is key. If you don't inhale strongly enough, the powder may not reach deep into your lungs. If you inhale too fast or too slow, the medication might not be delivered effectively. Regularly practicing inhaler techniques can help ensure the dry powder moves correctly and your treatment works as intended. In summary, dry powder movement in your inhaler means how well the powder is released and transported into your lungs when you breathe in. When the powder moves properly, your medication can do its job effectively, helping you breathe better and control your asthma symptoms. Always remember to use your inhaler as directed and ask your healthcare provider if you're unsure about the correct technique.